30 seconds.
Okay, you're live.
Good morning, South Florida, and welcome to the Dr. Pinozzo Health Hour with Dr. Anthony Pinozzo. A lot of you people might have forgotten to turn your clocks forward, but for those who remembered, we're here live with Dr. Anthony Pinozzo. And for those of you who are out of South Florida or out of the country, you can always go to pinozzo.tv and see this show live and be able to ask as many questions online as you want. Today is going to be a little special show. We're going to talk about runners and what runners experience. Dr. Pinozzo, in South Florida, we probably have the largest amount of people that belong to the runners clubs. One of the things that runners always seem to have a problem about is different syndromes. Explain to me what ITB syndrome is and why do people have so much trouble with that?
It's iliotibial band. And I think the approach to that is probably not accurate. A band like that, it's a muscle. Muscle, it has an origin on the greater trochanter, which is the bone, hip bone, and then it goes to the knee, and actually it flexes the knee, brings the heel up. Now, the way you have to approach that is there are several causes for that syndrome. In other words, it's a pain in the side of the leg, thigh. Now, the lower back can do that. The hip can do that, and it can be iliotibial band could do that, the origin of the muscle. In other words, the muscle was in the bone right there, and it has many sources. It's like, like that. It's not like a tendon goes to one spot, single spot, but where the muscle starts is like that and goes to the tendon. So you have to know how to treat that. What we do is we do a whole diagnostic on it, rule out the lower back, rule out the hip, and then whatever's left is the iliotibial band. Now, you have to think, well, why would that be bothering people? Why only one? Usually one, not two.
Right.
So this tells you that the weight-bearing issue, the engineering, the physics problem is what this is. It's not able to bear weight properly. So if you approach it that way, then you look at how the spine goes, you look at the hip, and you look at the knee. All of that is involved with this muscle. Now, our approach is just to isolate it where it's most painful and just inject it, and it comes right out. You don't have to do icing. You don't have to do anything. We do it all, and that's what people want. They want to go back to running.
That's right. Exactly.
They don't want to be treated. So we kind of get these techniques down pat, so they work. The only problem I have with this approach is that we can only treat what we know to be true. But it's so large that we may miss something, so it may take 2 days instead of one.
You know, it's very funny. One of the books I've read, why do coaches say with this injury it could take 7 to 8 weeks before a runner is better?
Because they don't treat it. I mean, you have to treat it like I'm just describing. And it's 1 or 2 days, and that's it. You're done.
And the runner who wants to run more than anything will be able to get back running.
Yeah, and in our office, we rule out, like I said, the lower back and the hip and the knee. All of that is ruled out. As, and if any of it's painful, and we have an examination for that, if any of it's painful, well, we treat that too. So that essentially it's 1 or 2 days. Sports injuries like that, you have to do it quickly. You can't do it slowly because, first of all, your athlete has to get back out there. Otherwise, they lose their edge. So you don't want to put them on a bench for any length of time at all.
So if I understand this correctly, and I think I do because I've had the pleasure of watching you work with these people, why would someone send their athlete who has this problem to a podiatrist who could only, I guess, diagnose, if I'm wrong, just let me know, can only diagnose from the toes to under the knee? And usually it might not be an actual problem with the leg. It could be something with the back or an alignment problem.
Absolutely. I have no idea why they do that.
So all your coaches
doesn't make any sense to me.
No, I mean, for all your coaches that are out there, I suggest, I'm not a doctor, but Dr. Pinozzo is a doctor, that we find out why you're getting a person who you're spending a lot of money to keep on out for 7 to 8 weeks. I think it would behoove you to see Dr. Pinozzo, and we should give him the opportunity to tell you how we could help you.
Well, the coaches, they feel responsibility for the players.
Exactly. I
And they
understand
do
that.
try to get trained. They go to lectures, but you know what? They're not getting the proper stuff because if this is what happens,
Mm-hmm.
they're not getting the proper training. You have to think that listening to a surgeon tell you about these things or a podiatrist is not going to be accurate. You need a little bit more than that, which I'm supplying that. There's no question about it. We actually guarantee the work.
Wait, hold on. A doctor say what? A doctor, did everyone out there, did you hear this? What has your doctor ever said to you? I guarantee the work. Could you just say it again, Dr. Pinozzo?
I guarantee the work.
And we have about 69,000 people that will write any letter to anyone that thinks what Dr. Pinozzo is saying is from a different planet. The other thing I always hear about, runner's knee. What actually is runner's knee?
I have no idea.
Really?
What
Okay.
does that mean?
I don't know.
They
I
have
saw.
pain when they run? I mean, the knee has, here's our approach to the knee.
Okay, I think that's a better way to do it.
However you get a pain, it doesn't matter. You still have to go through the same routine. We know what all the structures are of the knee. We can examine for each and every one of them. The most painful area, though, is on the outside. And here's a picture of it. See all that blue? Now, no one talks about the capsule.
Right.
That's actually where the pain is. Everybody's talking about the inside, but there's no pain fibers on the inside.
Oh.
So, and that's right out of the physiology book or anatomy book. And you doubt my word, look it up. Anyway, what I'm showing you is actual pictures that we use in medical school. So these are in a book, a Netter book, and they are very accurate. And all I did was color it in so you could see it.
So evidently not a lot of people are reading that same book that you
No,
read.
they're not reading
Okay.
All right. Now, when you have a knee pain, you have difficulty in weight bearing. You have to think in engineering terms. These joints. Here's another picture. You see the yellow there?
Mm-hmm.
These joints are designed to do a certain thing. When they're symptomatic, the purpose and their usage is not correct. So now you have to think, why not? Why not the other one? Why just this one? Is it swollen? I mean, you have fluid, you have heat. Or if you have fluid and heat, you have an infection, so we're not going to treat that. But if the knee is cool but still painful, now we can isolate it down to the periphery, to the tendon, to whatever works and whatever is designed in there, and we can pick it up and treat it individually. That's the best way to go. You never want. What we don't do is treat the inside of the knee.
Okay.
Why? Because unless you have swelling and heat, there is probably nothing wrong with it. So why touch it?
Unbelievable. Now, I think of being a runner over the years, many, many years ago.
But what I didn't tell you
Go
is that when we can isolate it down, we'll get relief from that pain that day.
And one of the things that I've noticed from many people that have thanked me for sending them into you is you don't let anyone leave that office until that pain is actually completed.
That's correct. They have to be happy, and I have to re-examine. And if they don't have that pain, then they can leave. Otherwise, I've got to work again. So,
Right.
And that's my obligation. I have to do that. That means that you're getting what you want, which is pain relief. Now, once we relieve that pain is not coming back.
That's amazing. That's
It is
amazing.
Yes.
So in other words, someone who has pain in any one of their ligaments or tendons or they think is a knee pain or a shin split, you can actually diagnose that, which I think is one of the most important things. Something else that runners always seem to have is plantar fasciitis, which I want everyone to think about that because we're going to be taking a break right now. There's so much that we have to talk about. We'll be back in a couple of minutes, maybe 2 minutes. Again, you're with Dr. Anthony Pinozzo, who can be seen every day, 24/7 on Pinozzo, PANNOZZO.TV. We will be back in a minute. We are back, and now we're going to finish where we left off with the term plantar fasciitis, which I was notified in the car today that people call that a heel spur, and I was notified by Dr. Pinozzo that no, it's not. So, Dr. Pinozzo, could you elaborate on heel spur? All I know is everyone I've spoken to about heel spur, they said they have to go into the orthopedic surgeon who recommends 10 to 15 stretching exercises by his other company.
Yeah.
Talk to me about this.
Yeah, plantar fasciitis actually is evident on X-ray, and everybody looks at that, and there's calcium formation in the bottom of the foot. But that's not where the problem is. The problem's up into the ankle. We treat those by injection. You have to, and that pain comes out that day.
Wow.
And not only that, but they're walking on it. So that's how we know. I mean,
Wow.
I always ask the patient. I say, go ahead and produce that pain if you can.
Really? Wow.
And
wow,
they
wow.
say, no, it's gone. And that occurs in 2 to 3 minutes. Now, I know people say, the guy's nuts talking like that. No, it's true. It's absolutely true.
And you-
Everything I say on here is true.
So, in other words, if someone comes in and they want to get rid of this heel spur,
Yeah.
that normally takes, let's see, according to what I read in a runner's magazine, 9 to sometimes 24 weeks. And you tell a runner that they can't run, they will go absolutely bonkers.
Absolutely crazy. Because, here, first of all, as a physician, you have to understand how physicians think. The way this physician thinks. If I can't get rid of that pain right away, it's because I missed the diagnosis. So diagnosis is primary. You have to have a diagnosis. Now, you're not going to get that from a lot of those workers out there in that field. It takes a little bit more. Not only that, but when you have this problem up in the ankle, the ankle is actually collapsing. So you have to think weight bearing from the lower back all the way down.
Mm-hmm.
So it becomes, my favorite term is a physics problem, a design and function problem. So when something goes bad like that, you can determine that something happens to the design of it. It's not bearing weight, and it's usually one side, not both. So you have to think, why one side, not the other side? So you have to bring in all of these factors from the lower back all the way down.
So, in other words, the people that are coming in for this are not being diagnosed correctly.
Well, that's primarily what I do is a
Okay.
diagnosis. The treatment is easy after you have a diagnosis. I mean, it's hard when you have to go 12 weeks of what? I mean, it's just ridiculous.
Because I know when they go, people have told me.
Now, further than that,
Okay.
Les, when you have this problem, you're beginning to get a flat foot.
Okay.
So that you have to take that into consideration also.
Okay.
So it's a little bit more complicated than that. And you know how people get flat foot. There's no treatment for flat foot, but I have a treatment for flat foot. We absolutely guarantee that flat foot will get straight. That's when you get the big toe that goes in and it's very painful. Well, that's just a joint capsule. That's all that is. That doesn't require surgery, although surgery is being done for it.
What about hammer toes?
Hammer toes is the same thing. It's a tendon pulls the toes up like this.
Right.
And you can treat all that. That's not a problem.
So wait a second. This is something that a lot of people I know, their wives can't wear sandals anymore, and they've gone, and the doctor has gone. The orthopedic surgeon. I'm not trying to knock all your orthopedic surgeons out there, so please don't take this to heart.
No, they do a different job than I do.
Right. So they go in, they break the toes, and they bandage them up, and they don't need that anymore if they come to see you in most cases.
No, we don't like that. First of all, there are several places in the body that's my personal opinion, my professional opinion,
Right.
should never be operated because
Okay.
once you cut through that skin, you're creating scar tissue.
Okay.
You do not want scar tissue in the fingers, toes, shoulder, TMJ. You don't want scar tissue there. You need mobility, and that's what we do. We produce mobility. Take care of the scar tissue. Now, on the hammer toes, the problem is actually up into the foot.
Oh, really?
Yeah. So unless you treat that, you can't get a good result. And then we call that a metatarsal phalangeal joint capsulitis. Is
Now,
what
you know
actually
we're talking to a real doctor, folks out there. He knows all these words.
which is actually what that is. And so we're offering if I can't do it really quickly, then you'll know that, because that's what we tell you in advance. So actually, this is where the hammer toe occurs. Right?
Could you show this to the camera so we could see
You
exactly?
can see it. This is an actual, like I said, right out of our medical book. So it occurs right in here. Metatarsal phalangeal joint.
So basically, a lot of people who didn't hear last week's show, almost $16 billion is spent on people going in for surgeries that, from what I'm listening to you, might not need to go in for surgery.
Yeah, that's true.
And you know what? If for everyone out there that's listening, if I had my druthers, I would rather not go under the knife. If I would like to check to see if this is real, and I have seen that this is real. Something I want to ask you, I'm going off on a little tangent now, because what you're talking about is so important. I brought in a young lady who was complaining about, and I can't mention her name, but most people probably know who she is by listening to her on the radio, who had a terrific problem with her knee, with her ankle.
Ankle.
And she was going, before she saw you, she was going to go Monday to see a podiatrist. Now, I want you to go through that procedure, because people might not understand what you're going to talk about. You met her, and tell me what it is that you discovered about this person.
Well, first of all, the pain near the ankle was a long time. I mean, weeks.
Right.
Yet, when my exam starts in the waiting room, by the way. So when I bring somebody in, I'm analyzing their gait already, and she was not limping. So I figured, well, this is probably not an ankle. So you have to be able to take a competent history that includes from the lower back all the way down.
Correct.
And if you go to someone who just works on the ankle, you're missing a lot, because there's a lot of referred pain that goes there, which means that a pain is caused somewhere else, you feel it somewhere else. So we start taking a history on that, and she had no back pain at all. But the area, I knew where it was, because the area, I've seen it before, 69,000 people, maybe 70,000.
Right.
You get to learn a lot, a lot of experience there. So I examined her, and we took care of her lower back. It was a disc pain, and we did our usual injection treatment on that. And by the way, the pain in her ankle left in 2 to 3 minutes.
Right.
And she was visibly shaking. I
mean, she was blown away, I know.
Does it go that fast? So that's the way it goes. Now, what we did for her is only available in my office and my son, Dr. Paul, in Arizona, in Peoria, Arizona, and we do that procedure. And I always tell people, it's kind of a humorous thing, but if you were a king of Saudi Arabia with $1 billion in your hand, you could not buy that anywhere.
Amazing.
It is what we do. We did the research on it. The results are phenomenal. It cuts a lot of treatment down. We 1-2 days for lower back, and that's it.
Really?
Yeah.
So I guess what's the most amazing thing is that normally the way people were always taught over the years is that if you have a problem in your foot, you see a podiatrist. So a podiatrist would...
well, actually, the orthopedist gave that up to the podiatrist.
Yeah, because they didn't want to do that, correct?
They don't want to work on feet.
No, they just want to do surgeries. So in other words, she probably would have been going for quite a while until she got that done.
Well, the usual procedure is they do physical therapy on it, then they put a boot on it,
right,
and then they inject it, and none of that works. Now, how do I know that? Because people come into my office and tell me all these things. So
right.
I don't have a special line into any place, but I take a history. And what kind of treatment did you get?
So you know what I would say to people out there? Make your second opinion your first opinion.
Yeah, good.
So instead of making Dr. Pinoza your second opinion, make him your first opinion, because you know what? To me, and I think most people that are here today at the studio and most people that are out there would rather go in and take a shot and be cured than know that they have to go in for surgery. I mean, back surgery, from what I understand, has always been, people that I know have been on medication and have been hurting even worse than they did before.
Yeah, and that's what you're saying is true, and they do fusions, and it makes it almost impossible to treat, although we do. But it's one of those things, you have to learn how to do it.
So for all you runners out there that are listening to the show, or for all you people that like to run or walk or go on a treadmill, and you're having pain, I think it would be a great idea, and this is just me. If you want, you can always call Dr. Pinozzo at his office at 561-381-5800. And one thing you'll notice about Dr. Pinozzo that you won't notice from other doctors, that Dr. Pinozzo actually answers his own phone calls. Dr. Pinozzo, tell me, I mean, you're so busy all the time. You always have time to see people. Why do you answer your own phone? I'm just curious about that.
Well, people have a problem, and if I can't know what it is, then we don't make an appointment. But it also gives me the opportunity, if somebody had a lot of trouble, I can bring them right in.
Okay.
Which a secretary can't do that. They're going to have to ask me, and that disrupts my day. So I'm attuned to taking the phone calls myself. We practically know what's going on over the phone, and then we can give them an appointment later or sooner. So if you have a problem, you can't walk, I'm going to bring you right in. I'll just work a little harder, that's all.
Well,
that's my job, you know. I'm a physician. I'm supposed to.
And you enjoy what you do. And as you can see, this time has gone by much faster than it's ever gone by because there's so much to do. We are now going to be taking we'll be taking a break in a little while. But again, for anyone that wants to call in today, they can call it on our hotline, 877-927-6969. If you'd like to speak to Dr. Pinozzo, he will answer your questions right now. We have someone actually on hold right now. You want to take this call now? We've got Josie from West Palm Beach who wants to talk to Dr. Pinozzo. Josie, you're on the air. I'm not hearing it, so I know Josie. Josie, please hold. We're just trying to find out how we could take this call from you.
Yeah, it's only the third program, so we have to work these things out.
We're kind of, she's still holding. If somebody could tell us how to get on to speak to Josie. Okay, so, well, let me talk about, so Josie, please hold on while we're waiting. So,
is there a question there?
Yep. She's on hold.
Oh, no question.
Yeah, she wants to talk to you.
No, I mean, the question's not on your screen.
Okay, so what we're going to do, Josie, if you don't mind, we're going to talk about something else, but we're definitely going to talk to you as soon as. Hello, Josie? Okay, so let me just say this, Josie, for anyone else that wants to call in, we're going to get this corrected. We're going to take a break, and Josie, we'll be back in about 1 minute to answer your question. Again, you're listening to Dr. Anthony Pinozzo. We will be back.
Only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP2 TV of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP, the number 2.tv. Or call them at 1-866-224-5422. That's 866-224-5422.
Pain is the body's way of telling you something is wrong. Surgery can do more harm than good. Pills can become addictive. Dr. Pinozzo uses engineered concepts and weight-bearing physics to resolve this pain and get you greater range of motion. Call today to resolve all those old excuses the medical profession has given you up to now. Call 1-877-927-6969. And now, let's get back to today's show. Thanks a lot.
Okay, we're back. So, Josie, we're sorry. So Josie wants to know, what type of injection is it that you use to take care of this problem?
Well, any problem you have, any pain is inflammation first.
Okay.
So you want to knock down the inflammation. And you want to do it rapidly. So the patient gets an opportunity to take aspirin or take a local injection. So That's how you get the 2-minute relief,
What is
because we put the
name of
medication right where I want it.
Are you talking about a pain injection?
And
like
it's a
Okay, Josie, tell me what it is that you'd like Dr.
Oh.
Pinozo to answer.
I want to know the name of the pain injection. Like, is it like cortisone?
Jody wants to know, is it a cortisone type injection? What is it that the injection is that you want to give? Is what Jody
well,
wants to know.
it's the classification that you have to use is the steroids.
It's a steroid.
Well, we use a short-acting, clear steroid. In other words, it doesn't last more than 9 hours. So you're going to get your cure that way, and there's nothing hanging around. The only thing it does is raises blood sugar on diabetics, but it's easily handled. It's just 12 hours, and that's it.
So this is
There
a
are
pain
no other
injection
effects from
that
it.
that
It's
lasts
the
a
most
certain number.
fantastic. It's the only thing I use on myself, and I'm hurting myself all the time. But that's the best thing that there is out there, and I've used. Thank you.
Hello.
No, we hear you. We hear you.
And so that's it. But you're asking the wrong question. It's not what I use. It's why and where I use it. That's what you need to know. Why and where I use it.
All right.
That's what makes it work. It's
Yeah.
not the drug itself, because if you don't put it in the right place, it doesn't work.
All right. So we go to you for the right place to put the pain injection.
That's right.
How long does this pain injection last?
It's a cure.
It's a cure?
Yeah.
A one-time only?
Well, it depends on what it is. I mean, if you have 5 things wrong with you, we're going to cure the worst one you have.
But it's
We can't do everything in one day. I mean, it's impossible.
I understand that.
Yeah.
But this injection is like a cortisone. It eliminates the pain.
Eliminates inflammation.
Well, that's pain also.
Well, that's what causes the pain. Yeah. It's top of the line stuff. So if you have what pain do you have?
Well, I have pain all over my body.
Well, I picked the worst one.
So you know what the worst one is? Old age.
Oh, okay.
Well, he can't cure that, but he can make he can make your life much better, Josie.
All right.
Josie, if you want, you can always call Dr. Pinozo at his office and make an
Thank
appointment.
you very much for talking to me, Dr. Pinot.
Oh, have a great day now.
Thank you.
Okay, now, Josie, it's very difficult to diagnose a patient over the phone, and if there are a lot of people like Josie that comes into Dr. Pinozo, and like Dr. Pinozo said, he takes care of the one that's bothering you the most.
Well, we'd have diagnosed her as she told me what her worst
Right.
pain was.
So, Josie, if you want to come in, let me give you the office number. It's 561-381-5800, and Dr. Pinozo will actually answer your call and talk to you. Again, if you want, you could always write in questions by going to Pinozo, PANNOZZO.TV, and we seem to be getting a lot of questions. So, like I promised, folks, I got to go and answer some of these questions. Dr. Pinozo, Paul from Miami wrote in, I played professional basketball and cannot use my real name for many years. League rules prohibit use of outside medical advice without approval. My agent asked me to write. Again, his agent asked him to write. I've been diagnosed with plantar fasciitis. Will your treatment work, and how long will it take to make a difference? And so other pro athletes in different sports have been affected recently. Are these things legal?
Oh, absolutely. They're talking about the steroids that put weight on. No, that's not what we use. We use a short-acting, 9 hours, it's all gone. You can't even detect it. In fact, they're not looking for it. So it is a top-of-the-line treatment for anybody, especially in sports. Now, the sportsman uses his body to make money.
Correct.
You have to keep it. It's like a machine. If you don't get it treated right, you're going to lose out. I got to tell you a real story.
Please.
That I saw a professional football player, and who had to retire because of back pain. Now, I took care of this back pain in one day,
Really?
and he was absolutely amazed. He told me that he would have bought me a Ferrari if I'd have made him play one more year. I said, "What are you losing? $11 million?" I said, $11 million. Oh my God! And so the problem with the sports injuries is it's that the owners have a contract with an orthopedic surgeon. Now, orthopedic surgeons are great; they do their job, but they don't do what I do. They don't do the middle thing, and you have a trainer who make a lot of money. These people are well paid, but they don't know the ins and outs of the anatomy, the physiology, the physics problems that we do.
That's important.
So now the orthopedic surgeon is losing the player. The owner's losing the player for whatever they're paying them. It might be weeks. Is that very smart? That's not very smart. So that and on the off season, a lot of surgeries are being done, and you lose players right there. So it is a bad situation because they don't understand that this is actually a workman's comp problem.
Really?
If you hire a player with a disability already, who's going to pick it up? They don't examine for that.
Exactly.
And I do. And I'll tell you another story. It's related.
Before you tell that story, I got somebody holding on now to
go
talk to you
ahead.
again. We've got Lenny from Lake Worth. Lenny, thank you for talk to me about what your problem is.
Yeah, I work 12 hours a day standing on concrete, and I have one of my feet that I seem to have, it's just constant pain on the bottom of the foot.
Okay.
And I mean, I know you can't diagnose it over the phone, but is it something that you could treat?
Oh, absolutely. We've been talking about plantar fasciitis and ankle pain and foot pain. Yeah, we could take care of that. Yeah. So why don't you call in tomorrow and we'll give you an appointment.
Well, Lenny, let me give you the number so you could actually call in and talk to Dr. Penozo, and he will see you tomorrow. It's 561-381-5800. Again, let me give that number to you. 561-381-5800.
Okay.
Okay.
Thank you.
Thanks, Lenny, for calling. We really appreciate it. Okay, now getting back, it's phenomenal. One of the other things that Paul wants to know about stretching: does he have to do any stretching after he gets the shot, or is this shot going to take care of him so he doesn't have to worry anymore and he can go back to doing what he does?
No, we'll take care of that pain by shot, only because it's faster, better. It's back to work. I mean, back to playing. And, of course, the diagnosis is done from the lower back all the way down. I mean, we do the whole job for you.
Well, I'm going to give you... I'm sorry,
Now,
Dr.
you're talking about stretching?
Yeah.
Well, we don't like stretching.
Okay.
Because if you have to stretch, what are you stretching? And why do you need to stretch? You have to ask that question. People go through a huge stretching procedure, and I marvel at this because what in the world are they stretching? If you have to stretch every day something, it should be treated. And so you don't have to do stretching. I get out of bed myself, and I can hit that golf club. I don't have to stretch.
Amazing. Now, we're going to be coming back...
And I'm old, you know.
We're going to be coming back to hopefully answer some of these questions, but our board is lining up. Again, if you want to talk to Dr. Penozo today on the air, it's 877-927-6969. We'll be back in about a minute and a half to try to answer all these calls and all the people that I promised we'd get to. So it's 877-927-6969, and we will be back.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. Dr. Pinozo is a world leader in helping those who have tried everything to get rid of pain in the body. When surgery or pain medicines aren't working, Dr. Pinozo is here to help. Range of motion increased over 65,000 patients that Dr. Pinozo has helped. And now he's here to help you. Call the show now, 1-877-927-6969, and let him help you get on the road to pain-free health.
Mike's alive. Mike's alive.
We are back with Dr. Anthony Pinozo. Again, for those of you who want to call in, the hotline number today is 877-927-6969, and I promise I'd get to as many calls today of write-ins. Veronica of Chicago, Doc, wants to know, my illness is hamstring related. Does this treatment help my case? I've been told I have hamstring injury was caused by a pelvis misalignment and my hammies doing extra work. Is this true? Well, she's the hammies. Okay. Is that true, Doc?
Hammies. No, hamstring pain is often referred from the lower back, and we know where it comes from, and we treat it directly. So you should lose that pain. Now, how you differentiate a local injury is by palpation. And we have a method of doing that. And if we can't find something local, it has to be referred. So you take a history. We do also a special film for that, which is I have a patent on this, so you can't get it anywhere else. And it tells me a lot. And so we know where the problem is. First of all, take the film, then we do the treatment. And then that's the 2-minute deal we talked about.
It's amazing. It's amazing. I mean,
Yeah,
it sounds
it
so
really
easy.
is. It really is, and it's not easy. It's there's a lot of years to do this, and you have to know a lot of stuff. You have to know anatomy, physiology, physics. You got to know weight bearing. You got to know it's weight bearing in motion. You have to know all that stuff. And,
So
so when I'm talking to somebody, taking a history or doing an examination, it's like my computer's working, and it rules out this, rules out that, and then the ultimate thing is to remove that pain in sequence. Now, if you could do that, your diagnosis was right, and that pain is not coming back.
So, Veronica, I just want to let you know that, if you're ever in the South Florida area,
I hope she's listening.
well, evidently she must have saw one of our commercials on the Golf Channel. So let me know next week if you saw our commercial of what Dr. Pinozo can do. And, it's so amazing that people are so interested in this today. Mike from Texas writes, I have been playing football for over 8 years and have been diagnosed as having Achilles tendonitis. How will your treatment work on my case, and how long does it take to heal? I have been told I have weak calves. Is this true? It means the difference between going pro and quitting the game. Wow, Mike. You really wrote a letter that I think is going to maybe hopefully save or improve your career.
A lot of feet.
A lot of feet problems. Well, today I'm glad we decided to talk about feet.
You have 1 foot, or you have 1 foot, or 2 feet. The Achilles tendon can be primary. Yes, it can be primary. But you have to figure out, why doesn't it heal? So again, you're talking about the diagnosis. You're talking about from the lower back all the way down. Behind the knee can do that. So it's an abnormal usage of that tendon.
Okay.
So if you think in terms of that tendon, you're gonna miss it, because if it doesn't improve right away, then there's something else going on.
So people, stop going in for surgery before you do them.
Surgery's not good for that.
No, I mean,
you never heal over.
I don't
Never.
think anything. I don't know of anyone, and I know I have a lot of friends that have gone through back surgery and knee surgery and all this. And it's very funny. Someone who went through knee surgery came into your office after the knee surgery, and he said, I should have come here before, and you fixed something that he was supposed to go back and have it again. I mean, come on, folks, let's understand. Yeah. Don't go under the knife if you don't have to.
Right.
The reason I'm rushing is I always promise people that when you write in and you take the time to write in by going to Pinozo.tv, we're going to answer every one of your questions. I've got Al from New York City. Oh, New York, my town, right? Al says, I have been running for many, many, many years. He specifies a lot of years. and I suffer from runner's knee and have been told to change my running style. Ice, shorten my miles. Will your procedure let me get back to my normal distance, my normal way of running? Will I have to continue the changes they have told me to do? I guess that's the old school, right, Doc? Ice, 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 ice.
Well, it's not helping, so he's got to know that. I always tell people, look, if you're going to somebody, and they don't fix you up in 2 weeks or under, you're in the wrong place. And I have a sign on my wall that I made up, and I put it up there. It says, if you're not improved in 2 weeks, you're in the wrong office.
Wow.
And I sign my name to it, and I really mean that. So that puts a stress on me that I have to diagnose properly. So this man is not being diagnosed properly.
Correct.
It should be removed right away. I mean, runner's knee, probably patellar, we remove that pain in 1 day.
And what's amazing
It's a
is-
large joint, so and it's not a part of the knee. It's on top of the knee.
Wow.
This is the patella right here. So it's on top of the knee, not in the knee, and it's treatable. And on the runner's knee, they're forcing it in, probably. I don't know what runner's knee means, I'm assuming.
I don't either.
But this patella is forced in there, which causes it to hurt. So we have to take that and get the mobility back. And that means, what's the back of the knee looking like? So we have to treat that, treat maybe the hip is causing that also. Lower back can cause that, short leg can cause that. There's a lot of reasons for having this, and it should be removed rather quickly. So if you're not getting it done, you're going to lose your edge on the running.
I think Dr. Pinoza is getting a call right now. That's amazing. I mean, I shouldn't give out that private number.
That's my office number.
So people are actually called up now. Maybe I shouldn't.
Dr. Pinoza.
See that? He takes the call, folks, right when he's on the air. So everybody, I just want to show you that everything we said is absolutely true. If a patient is in need, it doesn't matter what Dr. Pinozo's doing. I don't want to have any dead air, folks, so I'm trying to be as quiet as I can as Dr. Pinozo is answering a call. I think I'm going to go.
Motorcycle accident, yeah.
Oh. We're going to take a break now while Dr. Anthony Pinozo does his call. Please call back. We will be back in about 2 minutes. Thank you.
Please welcome a new sponsor to the show. It's AMP2 TV, the first and only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP2 TV handle all of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP2.TV. Or call them at 1-866-224-5422. That's 866-224-5422.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. You're listening to Dr. Pinozzo's Sports and Medicine Hour with Dr. Anthony Pinozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pinozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pinozzo's Sports and Medicine Hour.
Mike's alive.
We are back, and like I said before, folks, people are calling in like crazy. We had to go to a break. Dr. Pinozzo, tell me about that call you just got on the air, which is amazing.
Well, it was a man who was in a motorcycle accident, and he's limping around. And I said, "Well, give me a call tomorrow, and I'll see what we have. We'll bring him right in." I don't like to put off people who have a lot of trouble.
I know.
That's why I take the phone call.
I know.
They have to work. So we try to get them back to work and save money that way.
So that just proved everything that we have been talking about, folks. Here's a man that is not only committed, he's compassionate about people. In the middle of a radio show that's going all over the country, he stopped to take this call. So I just want people to understand the caliber of the man we're working with. Let me give another thing from.
Thank you. You never said anything nice about me.
Well,
before.
once in a while, Doc, I got to come out and say something nice. Make you feel good. For a lot of people to understand something, Dr. Pinozzo is a graduate of Ohio State University and has dedicated his life to helping people. Now, Michelle from Colorado says, I hope I could pronounce this word correctly. She has patellofemoral pain syndrome.
The telefemoral,
Okay.
yeah. That's what we've been talking about, that.
And one of the things she says, I have to answer her question. She has runner's knee, which I understand is irritating cartilage or on the underside of the patella. She wants to know how and what can she do to help this pain go away forever, and how long does the procedure take? Well, I hope Michelle was listening, but in case she didn't, go to Pinozzo.tv. Could you again explain what you said before about that, Doctor?
Yeah, the patellofemoral syndrome. Physicians, if they don't understand something, they put the name syndrome on it.
Okay.
Okay, so that there is no big question about what she's talking about, patellofemoral syndrome. It's a patella being pressed against the knee, which causes a pain. So it could be lower back, hip, and knee, and it's all treatable. You need a proper diagnosis. You got to find out why that thing is battering the knee, and we relieve those by shot. You have to, because you got to get the motion back. You got to get the inflammation down, and we do it right away.
Wow.
So I don't know who she's going to, but obviously not the right one. The left leg could be short also.
Michelle, you heard what the doctor said. You can always call the doctor, even though you're in Colorado. He could always send you to his son.
Who's in Peoria, Arizona. Yeah.
Well, why don't you give that number? Give that number for Michelle.
I will do that. 623-776-8686.
Fantastic. We're going to take care of you, Michelle. Now, a local, my God, we actually have another local. It's from Mimi. I guess you didn't hear the beginning of our show. She's talking about ITBS syndrome, and she says, will this treatment help me to get my running life back? It gets better with ice, but it keeps recurring. Why? Well, we're going to repeat this again because we promised. What do you have to do, Doc?
Well, she's got to make an appointment, come in, and we'll inject it out for her. We'll do a diagnosis of why that's there. From the lower back, hip, and knee, all of that is involved. And we do a special film for that. And then we'll take that pain out. It's going to be, it's a large area, so that might have to see her 2 days.
Okay, so
instead of one.
Mimi, now that you went to Pinozzo.tv, let me give you the number so you could actually call Dr. Pinozzo, since Dr. Pinozzo's in Florida and you're in Miami. It's area code 561-381-5800, or if you happen to be in the Delray area, you could go to 16244 Military Trail, Delray. Tell Dr. Pinozzo you heard him on the radio and he told you what to do, and now you really want to get it done and fixed. I'm rushing right now because we have Nancy from Colorado. Nancy says, I have been told I have stress fracture of the metatarsals, and surgery is the only way to fix it. I cannot run and have been off my feet for over 12 weeks. Will me doing this treatment either speed my recovery or fix the problem? Wow. Nancy, you have some problems here, Doc.
Well, in order to get a stress fracture, what would you have to do? You have to fall from the Empire State Building or something. You can't
Really?
get stress fractures. That's impossible. I hear that term all the time. I said, show me one.
Okay.
I never see one. Anyway, this is probably not a stress fracture, but could be the metatarsal phalangeal joint, like we talked about before, or the intrinsic muscles in between the in the foot.
Well,
It's all treatable stuff, and it's treatable rather quickly. You have to make a proper diagnosis. But stress fractures, we do not believe in those.
well, now before we go, I have a call coming in from Jan from Boynton Beach. She wants to talk to you about back pain. Jan, here's the doctor.
Hello.
Hi, doctor. I just caught your show. I wanted to call in and comment. I was in an auto accident, and you saw me a few years ago. I was bent over. 2 days after that auto accident, I could not stand up straight. I came to see you. You gave me a couple injections in my back. I think you saw me once, maybe twice, and I was as good as new after that. I was so thankful at the time, and I just wanted to call in and
I just got the chills.
Amazing it was, really. You really helped me with a minimum of seeing me and a minimum of things that I had to go through. I really appreciate it. It was amazing.
Wow.
Well, thanks
wow.
very much. I'll send you your quarter in the mail.
That's so. Yeah, I just got the chills. That's so nice to hear someone. Thank you for calling. That's really.
Yeah,
it
it was
really
very nice.
kind of
Thank you.
says everything we said. That this man really, really cares. Jan, thank you so much for your call.
You're welcome. Have a great day. Bye-bye.
Thank you.
Bye-bye.
Wow. I mean, this is this is really something. I mean,
This happens all the time, though. I mean, this is not unusual.
I know it's just so nice. But let's keep moving on here now. Benson from Boston. Here's what Benson wants to know. I've watched both your shows and understand what you're talking about. Thank you so much. What I don't understand is why is it that the regular medical community cannot or does not do what you do? Let's take that part first, Doc. He's got a whole bunch of things here. He wants to know why they don't do this.
Well, the pain problems are in disarray. First of all, the medical schools do not teach what we're talking about. They're taught by the orthopedic surgeon. Whatever it is, send it to them. All right, orthopedic surgeons are surgeons, and they do a great job. There's nothing wrong with it. But in between, before they do that, you have a musculoskeletal specialty like myself, and we actually treat the sources of a pain. Now, but you have to be able to diagnose it. Remember, diagnosis is absolutely essential. Without that first, you can't get treated properly, and you can get treated forever without a proper diagnosis. So we specialize in making the proper diagnosis of where that pain is from. In order to do that, you have to know the anatomy, the physiology, you have to know physics, you have to know weight bearing and motion. There's a lot of things you have to know which goes into that. We do a special film after an examination, and then we do a treatment. And if you get relief in a couple minutes, then that's good. But essentially, they're not teaching this in medical school.
Well, it's very funny because Benson also says the biggest medical names in the professional world encourage surgery to fix most major problems. Is this incredible? I don't understand what he means, but Dr. Pinozzo doesn't believe in surgery. And tell me, why don't you believe in surgery? I guess Benson wants to know. I know why.
Well, the surgery is unnecessary a lot of times because you're dealing with the pain-producing structure. So if you know where it is, you can treat it directly, and you don't need surgery. But that's the way it is. We just heard that lady with the back pain, and this is true. This happens every day. We're taking that pain out, and it doesn't come back. So I don't know what else to tell you. Proper diagnosis, proper treatment gives you the result. Even in my office, if I miss, that pain's not going away. So it's incumbent upon me to make sure that pain goes away while you're there.
So Benson, I'm just to let you know, I hope I answered all your questions. I mean, if you ever want to call up directly, this is a toll-free number. You could call and
Yeah,
ask
if he
the
has
doctor.
a problem to get treated, I'll talk to him about it. And,
So maybe next week, write this number down, Benson, 877-927-2727. 6969, and you could actually ask the doctor. I understand what everyone's saying. I mean, it's a question that I can understand.
Where is he from?
Benson is from Boston.
Boston. A lot of people fly in from New York and Boston and Chicago and Cleveland, and they fly in for a couple of days, get treated, and fly back out.
You know what, Benson? You can call up, and we'll even tell you a great hotel to stay by. We'll even tell you some great restaurants, because one of the gentlemen I know knows more restaurants than anybody. Come on down. You know, here's the way I look at it. No matter how good your insurance is, it's going to cost you a lot of money and a lot of time for surgery. I know you're talking about some of the biggest doctors. Here's my thing about big doctors. He's the best doctor in the world if he cures you.
That's right.
Okay, so I'm going to say I'm sitting here with the best doctor in the world because he'll cure you. And I
Well,
think
there's
that's more
there's a
important.
lot of PR going on in hospitals, you know.
Oh, sure, they hire PR firms.
They push surgery because that's where they make a lot of money.
Right.
I mean, if you go to surgery, you're going to spend $20,000 per day.
Plus rehab afterwards.
Oh,
Plus,
I mean, it's insane
and something
how
you
much
told
money
me,
is spent like that.
the drug. One of the things that Dr. Pinozzo does not do, folks, is he does not give narcotics.
Yeah, that's true.
And I think that is so important to know. I mean, you come into his office, I don't even think you see an aspirin there.
Well, aspirin is our drug of choice, but why use narcotics when you know where the pain is? Take it out directly, and that's it.
Well, folks, this show kind of really...
Oh, is it over?
I wish I had 2 hours because I can't even get to all the questions. So I want to tell everybody that what you're hearing can only be proven by going in to see Dr. Pinozzo. We could sit and we could talk for hours about what he does. A lady was so nice to call up and say exactly how she felt with Dr. Pinozzo. I mean, come on,
We
folks.
never got to autism.
Well, I guess autism is going to have to be done next week. There's so many things that you do. I want to again thank Dr. Pinozzo for being here. Again, if you want to speak to Dr. Pinozzo, call him at 561-381-5800, and we will see you next week. Have a good one. Thank you, Dr. Pinozzo.
This has been the Dr. Pinozzo Sports and Medicine Hour with Dr. Anthony Pinozzo. If you spend 5 minutes with Dr. Pinozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pinozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pinozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pinozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.
94.3 Real Radio. Experience